He's a go-getter, was very active, and I think very stunned when he came in.
I went from, 6:30 in the morning till 10, 11, 12, 1 o'clock that next day, every day, 7 days a week for 23 years, so it was very hard to slow down.
I met Walter when he was a patient here at Methodist. I identified him as a potential patient for me to follow. He had new onset of heart failure and AFib, and was going to be in need of a heart valve. The Care Transitions program, the pillars of the program were med reconciliation. Anytime anyone moves about within the health system. Once I went to a patient's home, we sat down and we talked about their medication, making sure they understood what the changes were, making sure they took those medications. Then I went to visit him a couple days later, and we had a long conversation about his medications. He or Vivian, his wife, would call me whenever they had questions.
And we did a couple of times call you on the weekends because things were going on that we didn't understand.
Well, I think that the Care Transitions program was really just a way for us to kind of dip our toe in and learn a little bit with a small investment. The next step was to transition into something bigger in terms of population management in general, with a lot of different strategies. One of those being the AMT, Advanced Medical Team, which is really, in my mind, very, very similar to what the Care Transition program function did.
The Care Transitions program was really a beginning. It was a start. It was something we knew that we needed to do, and it was an individual with this high-risk group of patients that Tammy mentioned.
Delivering better health care in a medical home. We are trying to use a care navigator to help us coordinate care better.
As the Advanced Care Navigator, what I do is I help manage patients with complex medical disease processes. And what I do is patients that have, congestive heart failure, diabetes, COPD, and so that they are better manage their disease processes to help them stay out of the hospital. Actually, the most rewarding piece of my job is when you're able to connect to that patient.
It's about the individual patient and their individual problems. Care Navigator program really is part of our cross-continuum care management platform, and that means we use telephonic case management with our nurse triage group, First Call. The Care Navigators link into the patient-centered medical home. We have a post-acute care interdisciplinary team and inpatient interdisciplinary teams. And so there's a lot of talking.
I have so many patient stories that I'm so excited about, and they love this new era of care that we're providing.
The Care Transitions model has changed my perception of my patients tremendously. It's just very rewarding to see great outcomes and make a difference differently.
A lot of things I didn't understand until I got a chance to talk to you. That helped me a great deal.
So I had a patient that I worked with. She's a diabetic, and throughout the course of her care, we worked very closely together. And within 3 months, we were able to get her diabetes in control.
I think the care program gave me the stability of I knew what to do, when to do it, how to keep up with my medications, how to keep up with exercise, how to keep up with your thinking that everything is going to change and be better from what you had done.
Well, it was a lifesaver, helping us, because it's a big responsibility to take care of somebody that had that kind of surgery, and it's scary.
What I really enjoy about team care is I enjoy my job now. I feel that I'm doing what I went to medical school to do.
It really does work. When you get close to your patients, they really do rely on you for a lot of things.
Healthcare reform is here to stay. Whatever you call it, we can't keep doing what we're doing. And we have left the old behind, and we're on our way to the new. And I don't see that everywhere. I really don't. I mean, I talk to people, and they say, you know, we're just going to kind of feel this thing out and see what happens. And I think, ooh, you know, that is not going to go well for them. But when I go places and I talk to other people, I think, yeah, we're on the right track. We're on the right track, and I think we're actually ahead of the game in many cases.